June of 2010, I noticed a hoarseness in my voice. At the time, I thought it was just basic laryngitis. After a while, my voice became really bad, and I almost lost all of my volume. I have to take a deep breath in order to use that as my push to protect my voice. It kind of seems like this is something I'm just going to have to deal with.
That was Stuart, who's been dealing with a hoarse voice and a painful throat for some time. He decided to go see otolaryngologist Dr. Brian Weeks at the Cinta Clinic in San Diego, California. Here's what happened.
Stuart, I'm Dr. Weeks. You've never had a problem like this before.
This is the first time.
What I'm going to do today, I'm going to anesthetize your nose so that I can pass a flexible fiber optic scope and actually take a good look at your vocal cords. You can see as a polypoid growth, and you can see when he talks that you can actually see those growths protruding into the surface of the vocal cord and not allowing the surface of his vocal cords to touch smoothly. Say, E. Your treatment will be to do a small procedure where we're able to go through your mouth with a small scope in place. Under a microscope, remove that growth. So we're going to go ahead and get started here. I'm passing this instrument now into the lung. What I'm seeing now is a very normal trachea. That will move to the vocal cord. So the goal of the surgery is going to be to remove this irregular tissue on the left vocal cord. And I'm just going back now and taking out some small pieces to send for biopsy so we make sure that we're not dealing with some sort of other abnormality. One of the most important things in a situation like this is that we don't disrupt the surface of the natural vocal cord. That's the really specialized tissue that's in the voice box. Just removing a very small part of the growth in the very front part of the voice box. You can see there's still just a tiny little bit of irregular tissue left. Now you can actually make out a lot of that normal vocal cord on both sides. Okay, I think we're finished. I'm satisfied with what we've accomplished today. What we'll do now with Stuart is we'll ask him to rest his voice and give these vocal cords a chance to really heal nicely.
And that procedure had happened just this past week, and we have Stuart on the phone. And I know, Stuart, by asking this question, you'll have to answer, how is your condition?
I'm feeling much better, thank you.
Wow! Your voice is so crisp.
Yeah, I feel like it's definitely life-changing, and it feels great.
Oh,
that is amazing.
That is a crazy change, but you're still on voice rest to a certain extent, right?
Yes.
So we won't ask too many questions.
Yeah. Right?
Yeah.
But you sound great, Stuart.
You
There's
really
no question
do,
about
Stuart.
it.
I mean, a complete success. And just to go over what Stuart had done, this is a picture of the voice box. You're looking inside. This is the base of tongue. This is the epiglottis, that structure that flops up when you swallow so things don't go down the wrong pipe into the esophagus. Most likely, in Stuart's case, he was straining his voice. He was using his voice in the wrong way, which caused this growth to grow on his vocal cords. Why does it change his voice? Because normally, when you speak, the two vocal cords, if I can do this, come together like so that you saw in the picture. Well, if you have this polyp or nodule blocking that, that's why his voice sounded so off, so hoarse, because the vocal cords couldn't properly come together. And then the minute that this mass that was preventing them from coming together is gone, his speech got a lot better. So in your case, Stuart, the important things, this was a benign condition for you. That's great. But, the speech therapy is going to be very important. You're going to have to change your habits, how you use your voice. But this is something that all people have to be, cognizant of, that something like this can be, cancer of the throat.
And the key here for Stuart, and again, Stuart, you don't have to respond because I know you're on voice rest, but these symptoms were prolonged. So if you are acutely sick and you get the quote-unquote laryngitis and you have a hoarse voice and it gets better over the next few days, that's no big deal. But if you're struggling with this and it's chronic, it means something else is going on in your voice box.
When you have a change in your voice for too long, when you have pain in your throat that goes on for a while, maybe bleeding from your throat, if you have a lump in your neck. Another important thing is if you're at a high-risk group, if you drink, if you use any tobacco products, that's smoking and chewing tobacco, you're at higher risk for all forms of head and neck cancer, including throat cancer.
You mentioned voice rest. If somebody's strained their voice, voice rest doesn't mean whispering. A lot of people think, oh, I strain my voice, I'm just going to whisper. That's actually worse.
The vocal cords are still,
voice rest means not talking at all.
So, Stuart, continue to rest your voice. We wish you the best of luck. Thanks for being with us. And we also need to send a big thanks to Dr. Weeks, who you saw in that clip performing the procedure.